Hi, everybody. My name is Natalie Yeadon, and I'm one of the CEOs and co-founders for Impetus Digital. At Impetus Digital, we have built some of the best-in-class asynchronous and synchronous virtual collaboration and communication tools for life science and healthcare companies. We've helped companies across the globe for the past 12 years do everything from virtualized advisory boards to doing working groups, medical education. We do big, large corporate events, sales training, and everything in between. But more importantly, we really believe at Impetus that everything starts with a conversation. And then from these big, hairy, audacious conversations, we can actually work with some of the provocateurs, the digital thought leaders, the interesting and intriguing entrepreneurs who are doing really cool, bleeding edge things. We can work to collectively and positively disrupt healthcare. And so I'm really pleased to have one of these digital thought leaders at the table with me today. This is Matt Park. Matt Park is the vice president and general manager from a really cool company called Dacadoo Americas, and we're going to get into this today. This is actually a company based in Boston. He has an MBA in international business from the Thunderbird School of Global Management, and he has over 30 years of experience in all kinds of different positions in sales and marketing as an executive in the software industry, including in HR, talent management, sales and management, operations, public relations, marketing, acquisitions, P&L rep responsibilities. He's done lots of work around international sales and services, as well as a lot of other interesting work at partner and channel management. So a very, very robust background. And in his current role as the VP, before his current role, actually, he was a VP of sales at Covidian and Success Factors SAP, also worked at Softscape and Human Asset Technologies. So welcome, Matt. So happy to have you on the show.
Thanks, Natalie. It's a pleasure to be here.
So what a whirlwind career. You have done it all. Tell us where it all started. Did you wake up with a dream one day and said, you wanted to be running this virtual company? So how did you end up where you are today?
Yeah, I think it all started with my desire to see the world. So I was, strangely enough, I was a language major in college. So, and for no good reason other than I just really enjoyed learning languages. And I was a German major, a French minor, and everybody tried to talk me out of that. And I just said, I'm just going to study something that I enjoy doing. So that led me to graduating from Villanova with a degree in German and wondering, what am I going to do now? So I went and got an MBA in international business. So that at least tied together, business with my interest, which was languages and seeing the world. And then I actually worked for, what you didn't mention there, I worked for Berlitz for 9 years, which is a language school and translation organization, which was always the big name in that business back when I got out of graduate school. So after I was there almost 8 or 9 years, I got into the tech business, and that was when I got a job overseas. So I always wanted to, I had already lived over in Germany a few times, but I wanted to go back, and that got me into the tech business. And I ended up living in France and England, also multiple places in the US. If I told you all the places I lived in, you would probably wonder if I was in the witness protection program or something. So, I really have seen the world and traveled a lot, and always wanted to do that. So I've been very involved in international business, in startups. Started when I went over to France for the first real job. Let's say I had worked in a grocery store in Germany before, but for the first real job after grad school, when I went over to France, it was to run an outpost office for a U.S. corporation, which was called Primavera Systems. And then we moved that to London, and then eventually I started up another company in London for a Boston-based company, and that's what got me back to Boston eventually after 6 years of doing that. And I literally started that company on my dining table in London and grew that to a very successful 4 offices in Europe and a big team and a big subsidiary of the Boston company. So I moved back, and I won't tell you my whole history now, but just to give you a little flavor of how I got into this. And And really all of that led up to, and I went through stages of the technology business, many of them in sort of earlier stage startup type companies for, in some cases, building US offices for overseas companies, and sometimes working in US companies that also had big, big desire to go international as well. So I was very involved in international. So really that combined with my real personal interest in health and wellness and nutrition and exercise and things like that, kind of all led up to me really getting interested in the digital health business just at a very opportune time when Dacadoo came knocking on the door looking for somebody to open up the US market in 2016. So 5 years ago, I joined Dacadoo, and it was really just such an amazing coincidence of things. It's Dacadoo is based in Switzerland, in the German-speaking part of Switzerland, in Zurich. So with my German and my French background, and I had lived right on the border of Switzerland when I was in France. And so we really hit it off, and it's been a great experience. And doing another startup company in the US, and here we are 5 years later in the US, and 10 years later as Dacadoo, which started 10 years ago. The company's doing really well now.
It is really fascinating how all these things somehow come together, that life is always conspiring for us. These bizarre tangents or decisions that we make in our life, and somehow it all kind of comes together. So really interesting how the German and all of these things triangulated into the place that you are today. So I love the name Dacadoo, by the way. It's really catchy and I love it. And ultimately, this is a company, it's a healthcare company, but it's really all app-based. And I'm wondering if you can describe a little bit about what this healthcare engagement platform for consumers, users, what are they getting from this? And specifically, if you can talk about that idea of the wheel of life associated with the platform.
Yeah, so the wheel of life is brand new, so I'm happy to talk about that. A little background on Dacadoo. So we are a pure digital health technology company. So we're really focused on technology. And it's a platform that allows companies to launch digital engagement apps to their end users, to their consumers, their constituents. We work mostly with insurance companies, both health insurance and life insurance around the world. We currently have about 120 people. And just like we have a group in the US and North America, we have a group in Asia with now adding people in different countries in Asia. And of course, several outposts in Europe, including sort of onshore and offshore development groups in different locations. So we are helping our customers, which are pretty large insurance companies, to connect with their end users and engage them in healthy lifestyle. And that's kind of the main purpose. We offer that in several different ways. So we can build the app for them and white label it and brand it. And then they can drive their own programs through the app out to their consumers, or they can use the back end of our technology to integrate into their own technologies, which is becoming more common as more companies are developing things themselves. So I think that ultimately will be probably the largest part of our business, especially in the US where there's a lot of development going on.
Very, very interesting. I absolutely love it. And there's obviously the pre-COVID world and then the post-COVID. And as you were mentioning, I'm sure your growth has been explosive in terms of everybody wanting to come on here, and a lot of issues around mental health, mental well-being. Tell us a little bit about how the COVID pandemic has impacted your business model and some of the other things and the other tools and products and services that you're putting out there.
Yeah, sure. So the initial impact, I mean, I love what you said. Everybody wants to come on and use Dacadoo now because of COVID, but the initial few months wasn't like that, right? The companies, our customers are insurance companies, right? Health insurance companies were redeploying all of their resources to deal with COVID. I mean, it was an emergency. They didn't know what way was up. And then some of our customers do have sort of EAP programs, employee assistance programs, that deal with the stress and mental well-being, emotional well-being. And they were just overwhelmed with requests from, corporate America, corporate, globally, I guess, for EAP programs. So yeah, the initial few months, I think, was trying for a lot of companies in terms of our customers. Life insurance customers also didn't know what way was up because, I mean, does this mean that, you know, mortality rates are going to change, et cetera? So they had to really stop. A lot of them lost a lot of valuation in the stock market, you know, initially, and had to, you know, rethink what they're spending money on. So the first, I would say, it wasn't until about midsummer to late summer where all of a sudden they all came back and wanted to talk, because then they realized the data was starting to come out that people that were getting affected were those that had comorbidities, weren't necessarily taking as good care of themselves, and that people who were generally healthy were not being affected as much. So all of a sudden, these customers of ours, these prospects of ours, realized, geez, you know, we were planning to roll something like this out to deal with health and wellness and help people live healthier lives, and we kind of missed the boat on that. So now comes the flood towards the end of the year, the second half of the year, and in January, I can honestly say we've never been busier in January than we are right now. So it is having a big impact long term. But the first 6 months were, you know, besides the fact that people were trying to figure out how to do meetings, right? Not everybody has you know, all their employees outfitted to work externally, and those are the people that we deal with. So they had to get all equipped to be able to work at home, in home offices, to be able to get trained on how to use things like Zoom, et cetera. So there was a big learning curve for a lot of people.
But you know, one of the other silver lining in all of this is that there has been an acceleration, if you will, of technology adoption. As you mentioned, working from home and using, you know, Zoom and other sorts of asynchronous and synchronous tools, including the Impetus Insight platform. We've actually gone through a similar growth trajectory. But the other piece of this is that people are using their phones in a way that they've never done before, downloading specific apps and really engaging with the healthcare industry in a way that we've never seen. So everything from patient portals to the types of health engagement platforms like Dacadoo. And so, you know, I'm going to want to ask you in sort of a piece by piece way of all the dynamics of what's involved in this engaging platform for the end user.
Yep.
Because these people are becoming much more conversant, they're becoming much more enabled in how to use these tools, and it feels more natural. Before, I think it was just for the, you know, very few or the very technologically savvy, and now it's a requirement because of COVID-19, because of social isolation and making sure that you're staying distanced. It's becoming a requirement. So you have something in your platform which I think is really interesting for your clients to use with their clients or their customers to engage. And that's this idea of the wheel of life. Mm-hmm. And you've embedded in your platform a series of almost pillars where people are needing to use these as metrics of their health success. One of them has to do with the physical health. So can you tell us a little bit about, you know, what people are doing around physical health and how this is being measured in your platform?
Yeah, sure. So I guess just a quick description of the wheel of life is sort of the first thing that users encounter on a daily basis when they go into the app. And it is a representation of 7 different areas that you know, describe lifestyle factors, and then 2 states. And one of the states is what we call the physical state. I'm not sure if that's what you're referring to, or if you're referring to physical health being activities, because we have
I know that there's several areas. You've got mental well-being, you've got what's your sleep like, how is your nutrition being managed. So there's all those factors that are incorporated in that wheel of life.
Yes. And so the lifestyle factors are meant to be things that people can actually control. Those are things that you actually are in charge of as a human being. You can eat better, you can walk more, you can, for the most part. I mean, there's probably some restrictions on some people for certain things, but you can work on your sleep, you can work on your emotional and mental well-being, you can meditate, you can do yoga, you can do things like that. So there's all kinds of things that people can do. There's certain things that you inherit and certain biometric things that you might not have as much control over, but can be influenced by your lifestyle factors. So we tie those things together and we allow people to see in the wheel of life where they stand in each of the factors. It all rolls up to a health score, which I'll describe in a moment. And then the health score breaks down into some sub-scores that include things like a stress score, a sleep score, an activity score, et cetera. And so people can see these are the factors that I want to work on, and then they click on the individual factor, like, we're talking about activities. What can I do physically to improve? And they'll see right within that, when they click on it, they'll see, where they stand today, what the suggestions are from the app. So we're scoring people's data. We're then advising them based on the things that they need. We're giving them very specific personalized advice. Here's some things you can do. Right now, we noticed that you're walking 3,000 steps a day. We recommend you try for the 5,000 step goal. Not a big leap, but it's something you can do. A little change, right? Start to create the behavioral change. It takes time, and something that's achievable. Okay. And then there's some articles that we might point to them to read. Say, hey, here's some articles about why walking each day for 30 minutes improves your health, and here's how it improves your health, and things like that. And we have hundreds and hundreds of articles. We have over 58 different specific goals in the app that we point people to based on where they are and what they need.
And how is this built? Is it built on a very specific, like, algorithmic, series of steps? If somebody reaches this goal, then automatically, algorithmically, doesn't matter who you are, this is your next goal? Or is there some sort of smart learning, some machine learning in the back end that's reading and leveraging your unique data as an individual that's going to point you in your own N of one health trajectory?
Yeah, so we do build in artificial intelligence into the interpretation of the data to help guide that. But more importantly, because we work with very large organizations, as I said, big insurance companies, I can name a few of them. Optum is one of our customers and uses the Optum My Wellbeing app, which is Dacadoo, is based on Dacadoo, to engage their multinational, the employees of their multinational customers. And so one of the things that we built for them is the ability to interpret a person's emotional and mental well-being, and then reach out to people when they hit certain thresholds in that emotional and mental well-being where they might need help or might need to talk to a counselor because they offer those services. So other insurance companies might have other areas of focus. And so that's where we build the logic for those customers, because it's no good to recommend them into programs if that insurer doesn't want to focus on that area. So yes, the artificial intelligence is there, but we point it in the direction of what our specific customer wants to focus on.
And that sounds brilliant, because everybody wants we hear a lot about personalized medicine, personalized care, really empowering the individual to take control as this tool is inevitably going to help do. I wanted to know if you can talk a little bit about the component around self-control. When we think about self-control, that's this big giant topic, right? And there's a lot of pieces to it. When we think about self-control, we think automatically of the opposite of lack of control, lack of willpower. We think of addictions and all of the ramifications of some of the mental health issues that might have cropped up since the COVID-19 isolation that's been going on. What does Dacadoo do around this module of self-control?
Yeah, that's an interesting area, and I think probably a lot of health and wellness apps don't have such a thing, right? But we decided that we should call this out somehow, and it's meant to mean that everybody has certain things that they might do that are outside of the strict guidelines of what is recommended, and you have to admit, you have to sort of allow for that in a way. So you want to say, look, drinking alcohol is okay, but there's certain parameters for that. Et cetera. So self-control is meant to be those sort of bad habits that people have, but if they do them in a contained way and in a controlled way, it's not going to hurt their health so bad. But be aware of it. So we have things like, be aware of how much alcohol you drink. So there's a goal for that. And again, once you get into a goal, then you start getting coaching automatically from the app about how to deal with that situation. So there's a number of things there: coffee consumption and alcohol consumption and smoking and things like that. So it means that we're admitting that we understand that you do these things, or I, as a user, I admit I do this and I'm going to continue to do it, but I want to be more aware of how I can control it better, not let it take control of my life.
Yeah, it sounds fascinating and a really interesting added dimension to some of the other types of apps that I think that have come out in more pioneering years. And so I'm also just kind of curious around um, the any of the research or the understanding that Dacadoo has had when building your system around these dopamine drips. We hear how a lot of tech companies have unfortunately used these in a negative way to lure people into, incessantly scroll through Twitter feeds or through Facebook because you want that little red button to show up or to
Yeah.
to get that, to capture that in, that piece of chemistry that keeps us motivated to keep coming back. How have you leveraged that scientific, neuroscientific, cognitive piece to the advantage of helping people build and sustain positive behaviors?
Yeah, it's a tricky thing, right? Everybody, I mean, let's face it, everybody knows what good nutrition is, what good exercise is, what good everything that you can control. Everybody understands what that is. I mean, who believes that eating cheeseburgers every day is better than eating broccoli? Nobody, right? I've asked these questions in large audiences and everybody raises their hand that broccoli is better. Everybody knows that. So how do you change behavior when you know that people need to eat better, et cetera? So there are every part of the app has this sort of gamification concept built into it in different ways. So one is, I mentioned there's 58 goals. The goals are built in a very specific formula way that we studied and we researched a lot on how to, how much time should a goal last? If it takes a year to achieve a goal, it's probably too long. You're probably going to fall off the wagon at some point on that goal. So that needs to be contained within, say 4 to 6 weeks, something like that, maximum period where you actually can achieve that goal. So the steps need to be achievable and they need to be progressive. And the system needs to recognize when you've achieved one step and move you to the next step. You get a little pat on the back from the digital coach and you're doing great. You only need, and keep telling the person how much more they need to do in little increments. So little bite-sized bits, and then you achieve a goal before you move on to the next one. So there has to be a sense of accomplishment and completion that is really helpful. On the other hand, we have challenges where people can compete with each other or teams can compete with each other. People can engage socially, and there's all kinds of dopamine drips that you get in all of those things, right? By being part of a team is already a wonderful thing, right? Because you try so much harder, or some people do anyway, get motivated by that. Other people get motivated by getting financial rewards or physical merchandise kind of rewards. And so that's in there as well. And all of these are tools that we make available to our customers in the platform to use as they wish. There's a points model, there's rewards, programs, challenges, goals, et cetera.
And is there anything that is human generated? So there's lots of opportunity to self-propel one's wellness journey. But is there things like lifestyle coaching? Like, does anybody ever get plugged into a real live coach if that's really works for somebody? And sometimes it works for people and sometimes it doesn't. But is
Yeah,
that something that's possible?
yeah, absolutely possible. And it's coming more and more with our customers. And I'll tell you why in a second. But the technology can detect what a person needs. So we score their health on a real-time basis. We then make personalized recommendations to that person. As I mentioned before, with Optum, we can recommend people speak with an EAP counselor. That's a live human being. We recognize when their mental well-being needs help. We hand them the phone number and say, hey, maybe you want to talk to somebody, or we can say it as direct or indirect as they want us to say it. But that's the digital coach reaching out to you as a user saying, in case you're feeling burned out and stressed, or maybe COVID's got you down, here's a phone number if you want to talk to somebody. That way, that person doesn't have to walk into HR and say, wasn't there some program I read about in January that you said we had where we could call? Nobody's going to do that, right? Because they're having an issue. They don't want to talk to somebody that they work with about it necessarily. So they miss the opportunity to take advantage of a program that is freely available to them. You can do the same thing with nutrition counseling, with activity, exercise counseling, with medical issues, et cetera. So we're detecting holistic health across not just lifestyle items, but also their biometric items and their emotional and mental well-being. We call it lifestyle, body, and mind. and we track about 100 data points, and we can figure out what a person needs. If our customer has live resources to handle those things, then we call that smart triage. We triage the person into those specific live human intervention programs. This is very powerful. Coupling digital with human is absolutely essential, in my opinion, to really have an impact.
It is really brilliant because if you really think about it, these day-to-day interactions where somebody starts to trust this as a system, and again, the dopamine drip, what brings them back over and over to get those rewards and to feel good about what they're doing, you're really doing like a point of care. Like this is, you're doing the interventions at that point of care, which, like you said, sometimes if there's a delay or you end up talking about something at some other point where you're not really resonating. So it kind of, you're getting them at that sweet spot, which makes it very interesting.
Yeah, and you're recommending something that is meaningful to them because it's personalized. It's about their situation, about their status. If we send out a message to everybody and say, hey, it's broccoli, it's National Broccoli Day, everybody needs to eat broccoli. Well, we know George Bush isn't going to eat broccoli, and a whole bunch of other people aren't going to eat broccoli because they've already said they don't want to eat broccoli, right? So, but if it's something about you, it's something that we noticed about you specifically and said, hey, here's something that we think could help you, then you're going to pay attention to it.
Absolutely. So, so the question comes down here around how we're visually stimulating people with their data. So again, data is boring, especially if it's given in a graph form, or just this table and it looks like an Excel sheet. Nobody's going to want to look at that. So how are you actually helping people to visualize their data in a fun, whimsical, and intriguing and appealing way?
Well, I mean, first we have to start with the health score, and I haven't really described the health score to you, so let me do that now. So the health score is essentially your, it's your credit score for health, let's call it, okay? It changes in real time, and it tells you how healthy you are every day. So I think it's very unique in the world because I think it's the only one out there today as a score that can track your health and rescore it every day. So it's a number between 1 and 1,000. And people say, why 1,000? Because health changes very slowly. So the increments, if you gain 1 point, I mean, you can't just suddenly go from 1 to 10 or 10 to 100 or something like that. So it's going to change incrementally and slowly. But you get feedback immediately from the system when you do something healthy or not so healthy. You're going to find out you gained a point or two, you lost a point or two, you get instant feedback. I believe that instant feedback is completely missing in the world of healthcare today about your health. You go for an annual physical, you get a blood test, the doctor says, well, your cholesterol went up a little bit or your blood pressure's up a little bit, but it's not time to put you on drugs yet, so we'll see you next year. Missing a big opportunity, right, to monitor that person over smaller increments of time and help them to control it and get it going in the other direction. Until it hits that point, and the medical industry or the healthcare industry has pretty much been set on, once you hit that threshold, then it goes from nothing to we're going to put you on statins, we're going to put you on blood pressure meds, we're going to put you on something else. And then you're on meds for the rest of your life. I believe that, giving people information right away that, hey, you're getting a little less healthy, a little more healthy, will help them. Changing behavior is tough, but it will help them to make some changes.
And give them something tangible and objective, right? So I think that's what you were really saying is how do we do this when there's all this qualitative stuff out there and scans and this, that, and everything, and somebody's giving you their subjective perspective on it, but you're kind of trying to take that data and adding a real number to it so that you at least have some sort of a scale to manage yourself on a regular basis.
Yes, and it does break down. There's a single number of your health score, 1,000 being the highest and 1 being the lowest. But there's a single number. But then underneath it, there are subscores across lifestyle, body, and mind. As I mentioned, we track about 100 data points that then compose that score across lifestyle, body, and mind. And there are subscores that people want to go in and say, oh, how's my sleep score doing? How's my lifestyle score, my mind score, et cetera. That data is all there for them to explore, and they can even look at their history of the scores and see, okay, well, I didn't sleep well that last week. Something I need to work on.
Brilliant. You also have described a concept called a risk engine. And this is really the quantification, if you will, of things like mortality and morbidity. Can you explain a little bit about how this works and why this is important to your insurance clients?
Absolutely. Yeah. So it happened because of the insurance clients. So the health score is built on 300 million person years of clinical data. This was the brainchild of a MIT professor, Dr. Lawrence Jacobs, who was a theoretical physics professor, by the way, and also then moved into medicine when he moved over to Switzerland. So he was at MIT for 20 years, moved to around 20 years, moved to Switzerland into the medical field, working in cardiovascular disease research. And our founder, Peter Onimus, had this idea to create a way to score health, and was able to find Professor Jacobs. So this was just luck, because maybe luck and maybe fate, but this is a hard problem to solve. How do you score human health? And so together they came up, or Professor Jacobs came up with the models, et cetera. So the first thing we did was create a score that would engage people and tell them how healthy they were, which I've described. This is the score that you get feedback in the app on a regular basis. Hey, Matt, your score went up a point, good job, or you lost 2 points because you didn't sleep enough yesterday, et cetera. Then when we started presenting this to insurance customers, they said, that's great. I can see how that would engage people. We would love to get our hands on the data underneath that score that says what's really going on, like what are the risks that are created there. So in fact, we were calculating mortality and morbidity risks before we sort of neutralized it into a fun score for the person. So based on the request, we created the risk engine and brought that out. We productized that whole thing in 2018. And they now use that for underwriting purposes and for population risk analysis. So underwriting means that if somebody wants insurance, and as they're applying, we can take their data, ask them a few questions, maybe pick up some lifestyle data, push that into the risk engine and calculate a whole bunch of information and give that back to the insurer for their underwriting process. And that helps them a lot with the accelerated underwriting process that's going on today. The new generation of consumers does not want to wait 2 or 3 weeks or 2 or 3 months to get an answer from an insurer if they can get a policy. They want to go online and buy a policy. So this enables that process.
So are you suggesting that some of your clients, your insurance clients, may not even use Dacadoo in the fun, interactive, consumer-generated way? It could be more like an intake system that allows for dynamic pricing, and then what you were calling the pay-as-you-live process?
Yeah, it's hard to believe, isn't it, that they wouldn't use the engagement thing? I'm just kidding. No, it's true. They can use the risk engine as a standalone if they wish. And some customers we have such a need for this type of underwriting process or assistance from what the risk engine provides that they start with the risk engine. But we expect over time that companies that started with the engagement will add the risk engine and vice versa.
And you've actually also developed, in my opinion, a really cool tool called the Walking Campaign product, which is really this sort of geolocation, walking, walk-based app, very similar to like Pokemon Go.
Yeah,
Can you describe what this is, and what was the purpose of this, and how's that going?
Yeah, this was also an idea from a life insurance person that we were speaking with. And the product is called dakadugo. And the person that we were speaking with, it was a very senior person in a major global insurance company, life insurance company. And he said, that might work in the US, he said, but for, doing the full engagement app that we offer, because does everything. He said, but over here in Asia or in Europe or whatever what country he was talking about, I don't remember. He said, I don't think they're ready for that. I think if we could just have them walk more and have some kind of game where they had to walk more and we collect the steps, I think we could sell that. So based on that, we had our head of data science and innovation climb up the mountain in Switzerland somewhere for a couple of weeks and came down with a product called Dakadugo. I say that as a joke, but actually that's kind of like how it works. Okay. So So anyway, Andre came back with this sort of draft version of Dakadugo, and yes, it's a very interesting product. It is a augmented reality sort of. So when you open it, it basically knows where you are based on your location, and it will know all the streets and all the locations. And then the objective is very much like Pokemon Go. It's to go find something, right? It's to go chase, things. And it can be highly customized for the customer. So we had one customer that wanted to have, you know, things about their company that had to be found and picked up, like historical, items about their company. So employees would have to go around and do that. And whoever got all of them first would get a prize. And then there would be the top 10 prizes, things like that. So it's very interesting, and it's really gets people out moving. Let me tell you, it's really fun.
It sounds fantastic. And you also mentioned it's something around collecting vouchers. How do you do that in a virtual world?
I don't remember saying we collected vouchers, so I'm not sure what you're referring to.
Yeah, I just wasn't sure if there was anything physically that people would have to actually collect on their
With
walking.
with the Dacadoo Go thing, you mean?
Yeah.
With Dacadoo Go, yeah. So yeah, it's virtual. Yeah, you pick up virtual, vouchers essentially as you're going out. You can call them they can call them whatever they want. So yeah, they can be called vouchers. So as they get to the different locations that the map shows them, where the prizes are, then you collect those vouchers, and they can be cashed in for prizes like T-shirts and other things that the customer wants.
Would any of your clients ever consider doing this for their own internal companies or events, for a single day event, and just do kind of like a Dacadoo Go, single day event that they pay for this sort of customized app? Is that something that your company has explored?
Yes, but it wasn't really going to be a single day. It was going to be like a 2-month kind of thing, just like a contained thing. I mean, you could do a single day event, I guess. I'm not sure you would need the Dacadoo Go for that. You could just use the regular app to do a challenge for the day, because in Go you get sort of it's very highly gamified, where you get more points and awards and prizes as you go to different stages. So it takes a little bit of time. So the idea is to keep people kind of chasing after something for more than just one day.
So coming back to the actual platform and the data that's retrieved, I'm assuming that a lot of the data is inputted directly by the user. What is your thoughts around, the seamlessness of data transmission? So we want to all eventually get to a place where we are transmitting data without thinking about it. So ambient biometrics. So
yeah.
Everything from facial recognition to feeling, to reading the temperature on your face, to the intensity at which you're typing on a computer keyboard. So what are you thinking about? What is going on today in terms of data transmission, and what do you foresee in the future?
Yeah, so I think in the future, the more that can be automated, where the person doesn't have to input anything, that's got to be the goal, because people really, just don't want to input anything. And even if you could, you should be able to speak to it. You should be able to say, hey, I walked 10,000 steps today, or however you want to do that. Right now, we do collect most of the stuff that a person would need on a regular basis. We collect in an automated way, or semi-automated in some respects. But we connect to all the available tracking devices, including all kinds of sort of monitors as well. So blood pressure monitors, glucose monitors, heart rate monitors, things like that. We can connect to all of those as well. And digital scales, so we can collect people's weight. For the blood values, we can collect that if the person is going to a place that has, are storing the biometric information and they're making that available. If it's an insurance customer or it's a corporate customer, a lot of times they do perform a biometric screening service. And so all the data does get collected in one place. It gets uploaded into the Dacadoo database. So we get all of that in an automated way. The more that can be done automated, the more people will continue. There's a lot of data that we have on users that use tracking devices versus users that don't use tracking devices. And it's very clear that the users with tracking devices are more engaged and stay engaged for a longer period of time.
It also makes me think about, who your target audience. Obviously, we've talked about insurance companies, But I'm also just wondering about the end user, looking at individuals themselves as consumers. So there's a lot of people right now who invest a lot of time, energy into productivity tools, and they're looking at a lot of automations about how to plug and play their personal goals, macro to, to micro on a daily basis, and then being able to use tools potentially like Dacadoo and others where the daily goals are passing back and forth between systems. Are these the kinds of future things that Dacadoo is considering, or it's really the major focus for you is insurance companies?
It's well, right now it's been insurance companies because there's a huge demand there, and there's a couple of new things going on there that I'll mention. But there are a few other avenues, I would say. Because we have companies using the back end of our system as well. Digital health technology engineers, developers, development companies, or any kind of corporation that is building tools like that is going to be a customer of our back end, okay? Because they already have an app. And how many apps do you want to have in the hands of the consumer? Hopefully one, okay? And that can do all the things that you want as an organization. If you keep pushing into other specialty apps, they're gonna fall off, okay? They're not gonna be using all of them. So on the one hand, I think that getting the back end into the people's hands is really important for companies that don't have their own front end already app. Then we build the white label version for them, customize it for them.
Yeah.
So outside of insurance, I see technology companies and companies that have big tech departments, and we're working with them more and more. Now, there's one other group that for years I've been saying, geez, we keep talking to people and nobody's really moving forward. And that's the health systems themselves, okay? And I always was wondering, why do we get so many people coming up to our booth at the conferences, doctors, and saying, wow, that's really cool. I would love my patients to use that, but they could never move forward. And suddenly, and maybe coronavirus had something to do with this, suddenly we have health systems that say, we have an initiative now to focus on prevention. So health system, okay, the integrated health system with the that has a health plan as well, that makes total sense because they have both sides of the equation there, right? So, and if they're an ACO, accountable care organization, that means that they're incented to help people, to not only just treat them, but also if they can increase, if they can start focusing on prevention, which I think is the holy grail, right? So, and I'll talk about that in a second, and we're starting to see more organizations that previously were focused on treatment and care now saying we want to move upstream and focus on prevention as well. And I'm thrilled. I'm really thrilled to see this happening, because if you think about it, there's some percentage of people that have chronic illnesses, right? And maybe that's 15 to 20% of the population. Maybe it's a little higher in some locations of the world. I don't know. But that percentage doesn't go down. So as those people, maybe they're getting treated, maybe they're being, their lives are being prolonged, but people that are healthy eventually are also moving into that group. As people move out of that group, they either get cured or they die eventually. Then there's other people waiting on the sidelines that are healthy one day, and then they get diagnosed with a chronic illness the next day, and they're moving in. So that group is getting bigger, and it's an increasing problem around the world. I mean, it's well-reported global health problem. So to move upstream to prevention is the holy grail. The money has been flowing to treatment because you can calculate the ROI much more easily. It's very difficult to calculate the ROI on prevention, general health and wellness. Although I just read something that Cigna put out, which was really interesting, a very detailed study about the ROI on health and wellness programs, and includes prevention in that. And it's a real ROI, and it's a lot of data that they uncovered. So I'm very, very hopeful about this.
I completely agree with you. I do think that's the holy grail, and I absolutely believe that that's actually the imminent future. There's a lot of companies that are actually going in that direction, and the money is flowing in that direction. So people absolutely put their energy and focus wherever the money flows, and that's where the money is going. So I think, again, with today's change in administration at the, I think it'll be very interesting to see what happens with healthcare, I think, in the next several years.
Yeah.
So with all of that said, is, working with other people and socializing this and being able to interact, especially for personalities that need accountability partners. Some of us don't, but many of us do. The majority of people do. But tell us a little bit about concerns ultimately, especially in, with cyber warfare and cybersecurity issues and encryption and not encryption and all these sorts of things, cancel culture.
Well,
What are some of the words of wisdom that you share about the world around people, what they share, how they share, and how do people can, at the end of the day, control their data?
yeah, so there's very little in the world that's probably, more personal and that people care about than their personal health information, right? And just a point of data that always kind of gets me, and that is that in many corporate wellness programs, which are studied pretty well, there's lots of data from those, where they generally offer a health risk assessment, at the beginning of the plan year. And for that, those employees typically get about $200 or $250 just to do the health risk assessment, which includes a biometric screening, which means they are going to take blood. Only about 50% of the employees actually go do that. And I'm always astounded. I'm thinking $200 to go answer a few questions and give blood. I mean, can I get 200 for each arm? I mean, go ahead and take my blood, right? So that's easy money, but still people are worried about what's my employer going to do with that information? Are they going to use it against me, right? There is evidence that's been coming out of studies that McKinsey has done and Accenture and other companies that indicate that people, and this varies by region around the world, but if you give people incentive, for giving your information, if there's some kind of incentive, then they will do it at a much higher rate. Okay, so I think maybe the $250, maybe that's not the right incentive, but they are willing to share their data more and more, it seems like, as they start to become more used to, I think, the idea of digital health. So hopefully that will keep going forward and people will not be so worried. But on the other end of the equation is companies like Dacadoo, who have to guarantee those people that we understand this is the most important thing to you, and we're protecting it with the right data privacy, tools, security, GDPR compliance, HIPAA compliance, and all of those things. And
so there's a question that's come in here asking if we gamify walking target achievements, and then do you get any kind of social conformity with that?
I'm not sure what is meant by social conformity. I mean, we certainly gamify, the goals of walking and the achievements for walking. So there's all different kinds of things there. You can get points for that. You can get rewards for that. I'm not sure what the social conformity is.
I guess maybe if people eventually reach a consensus as everybody starts doing the same thing.
Oh, I'm sorry. Yes, I get it. I can say that if you do it in the sense of a team goal or a team challenge, you get a lot of impact on social conformity. Yes, I think that's a great point. We do allow people to also choose personal goals that nobody else would know that they have that goal for themselves. Okay, so it's up to the individual. Not everybody wants to go out and be part of the team and run and jog and do things like that. But yeah. Once you get in a team, we do it within Dacadoo. We do several team challenges every year, and that's the funnest thing for me, that's the funnest thing that we do all year. And that's the times when I walk or run or do whatever it is in that challenge more than I ever would do on my own, way more, because it's part of
so it's always that balance about sharing. So it's social, so it's invigorating, so it's motivating, but at the same time balancing that, as you were alluding to earlier, about how much do you share with the concerns and fear of, is this going to be used against me? Am I going to get insurance? Is this, how is this going to impact my lifestyle? So it is an interesting balance. And I also was wondering if you could comment on how aggregate data that you are collecting can help the greater good. When we talk about population health management
Mhm.
and integration with healthcare systems, what is your thoughts on that?
Yeah, I think that, it's one of the things that is generally missing again in the healthcare space is the ability to understand what somebody's health is at any given moment, right? So if you had that feedback coming in every day about your health score, like what we call the health score, and you see it going up and down, and then you say, hey, let's look at a whole population. Let's look at our whole company of 100,000 people. And you can see the health score varying by region of the world for your population, or you could see it by age group or gender or whatever group. And you could start to say, hey, you know what? Let's help the people whose scores aren't as high. And we see that in this demographic, we're not having as much impact. And then you dig down on that and find out, well, we're offering challenges and goals that don't interest that group. So let's change that, right? So the ability to do this instant analysis by having a health score that can be applied to an individual, but then can be aggregated to a population, it's all in the same big database, allows you to instantly understand where to drill down and then find out what's going wrong here and fix things instead of doing a 3-year, clinical study and try to map it to claims in the end, which a lot of companies have tried, which always fails. Or I shouldn't say always, there's been some successful ones, but it can fail very easily. You could do things right now. How'd you like to get to the end of a 3-year study and find out that it failed, that you're not having an impact on people's health? That would be terrible because you've been kind of using people as guinea pigs for 3 years. So why not do something where you can measure it in real time? Are we having an impact? With some people, yes. With some, no. Let's find out and improve it.
So in terms of the business model, if somebody's actually obviously paying a subscription or this software costs money. So what is the business model or the business case that you're showcasing to the client? What's the win? What could they have spent versus what are they saving based on the outcomes? And I'm alluding to this whole idea around, again, some people are aware of the software as a medical device and going down the clinical trial way and being able to actually show this in actual data. But, assuming that you're not doing that, how are you showcasing the business case for people to actually pay the subscription?
Yeah, it really has to map to a variety of goals. It's not just talking about an ROI. I mean, it's pretty simple. If you can say, you don't have to think too hard to say, if we can improve people's health, i.e. make them healthier, they will eventually go to the doctors less. Pretty simple logic, right? Nobody's going to argue with that. If they go to the doctor less, they're going to spend less money in the healthcare system. Again, so if we can improve people's health, then they'll spend less money, claims will go down, et cetera. It's all good for the healthcare system. The only problem with that equation across the board is, how do we know we're improving people's health? Because unless they have a health score, like the one Dacadoo created, you can't measure their health in real time. So you have to kind of do other things to try to figure out if you're improving their health. And so I think that's something that has been really missing is you've got to have a way to figure out how to impact the measurement of that. And we see that with our customers that are able to get this data and see how they're improving the health. Now their goal may not be specifically for an ROI in savings. It may be that they have programs in place and they want to increase the utilization because they know those things will improve the health as well. So let's say we have nutrition coaches standing by to help people eat better. And I know that a lot of health plans have these, and they will tell you, we're not getting that many calls. This is a free program for our members. And they're not calling saying, hey, how can I eat better? How can I lose weight? And there's people standing by who are professionals, trained nutritionists. But what if the app was tracking your nutrition and saying, hey, Matt, we noticed this pattern. Would you like to speak to somebody? You have free service available and they could help you. And that's probably something I would do instantly. I would say, yeah, let me talk to that person. Okay, so we can drive up utilization of all these other programs where there's live, and as I said before, combining human coaches with digital tools and coaches is a way better combination, right? So we could do that. We do it for the EAP program, like I mentioned before with Optum, and other customers, where we push people, not push them, but we push the messages to those people who need it. And then they take advantage of a program that's there and they forgot about it. They didn't know where the phone number was, whatever. And it helps them, right? So that's going to help that company, that organization. Eventually that'll show up in ROI, but that's not the main driver necessarily. Is we want to save money. We want to help people is a big motivator. With some organizations, it's about, we want to keep our members longer. We want to create an engagement with our members that we don't really have. Health insurance, engaging with a health insurance company is basically when you need to find a doctor or you need to pay a bill, right? That's your engagement. Not a lot of fun, but those are things that you engage with. With life insurers, it's about paying your annual bill. That's pretty much it, your annual premium. Otherwise, you have no engagement. So they're missing a huge opportunity to take a bigger role in the people's lives that are, their members, and have an influence on them and help them and keep them happier. And let's face it, that's good for business, right? That's good. That's not just altruism. That's good for business to have your members know that your brand cares about them and you want to keep them as members.
So this is a really great note to sort of finish our discussion on today. And I think it really comes down to, in a technologically driven world, it still ultimately comes down to real people-to-people relationships. And I think the aspiration here, and really I think that the telling truth, or what is going to be imminent or planned in the future, is what's going to happen in this world of many, many technologies. As you were mentioning, there is an opportunity for minimization and subtraction of all these apps that are available. So we're hoping that we'll see Dacadoo as one of the ones up there, again, because we do see that there's the Aura Ring, and we see that there's, Fitbit that just, again, has officially been purchased by Google, and so many other players in the market. Is how do we get into a place of consolidation and simplicity for ultimately the end goal of the well-being of human beings? So this has been a great conversation. We could literally be talking for a long, long time. This is a fascinating topic. For those people who are interested in speaking to Matt, I know that we're talking about insurance companies, but there could be tons of employers. And again, we're just talking about this opportunity with medical associations, hospitals, other institutions. We're going to leave Matt's contact information if you're interested in speaking further. We'll leave that in the show notes once we publish this on our YouTube channel and our podcast. And I also invite some of you to also check out impetusdigital.com. If you're interested in these kinds of conversations, how do you actually create an employee program like this? How do you engage with your users or your customers? How do you go beyond what your products and services are? We can help you with these virtual advisory boards through a series of touch points so that you can actually garner great insights and strategies and ideas from your customers. So we invite you to do that. Please like and subscribe so other people can find our information. We've really appreciated your time, Matt. This was an awesome topic, and wishing everybody a wonderful day ahead.
Thank you, Natalie.